There's a spectrum of psychological changes that can occur perinatally, often referred to as PMADs. Women can experience not only depressive type disorders, but also anxiety. Keep in mind, most women do not experience any mental health disorder after having a baby. They experience changes, challenges, and growth, but not a disorder. That being said, it's important to know what can happen so you can do your best to prevent it or to identify it in either yourself or a friend. Mental health issues often exist along a spectrum, from mild, short-lived adjustments to severe disruptions in the ability to think and function. The techniques in this course can help prevent or diminish the adverse effects of all of these disorders. I'll start by discussing the mildest and shortest adjustment, postpartum blues, historically called baby blues. This is when women experience a couple days up to 2 weeks of tearfulness after having a baby. It's not a disorder, it's an adjustment. It's very common to experience this. It has been estimated that about 80% of women feel this way postpartum. Like PPD, postpartum blues is often attributed to the sudden drop in hormones. Hormones are likely part of the cause, but let's not minimize the significance of what a new mother has just gone through. It takes time to recover from birth, but that time is not given. Instead, mothers must immediately care for a baby, provide its food, make medical decisions, and ensure the baby's every need is met 24/7. At the same time, she's not allowed to sleep. This on top of the poor sleep she got during her pregnancy. She may also be simultaneously trying to tie up loose ends at work, care for other children, and entertain guests who are visiting to see the baby. So yes, it makes sense that mothers experience periods of feeling overwhelmed or the urge to cry. Occasional crying or emotional release seems like a very appropriate reaction, if you ask me. Now, moving slightly down the spectrum from mildest to more significant is postpartum adjustment. In postpartum adjustment, a woman experiences some of the feelings of depression or anxiety, but the symptoms are not severe enough or lasting long enough to meet the criteria of PPD. This is likely a normal reaction to the stressors and massive life changes that occur after having a baby. Being a part of a community of other moms helps to normalize this transition. Talking with a perinatal therapist can also be helpful in navigating this time. Next is perinatal depression, which I've already discussed. PPD can range from mild to severe. The more severe it is, generally, the more the ability to function is impaired. Some moms can look completely put together and take absolutely fabulous care of their babies, yet still feel profoundly depressed. You cannot tell by looking. This is why all prenatal medical care providers and pediatricians are expected to periodically screen for PPD. Bipolar disorder used to be called manic depressive disorder. People with bipolar disorder have mood swings that alternate between depression, low lows, and manic episode, high highs. And some people have mixed episodes in which they may simultaneously experience symptoms of both. Manic episodes cause a person to experience periods of time with excessive energy, rapid speech, and irritability. They often feel like they need less sleep or may demonstrate impulsive or erratic behavior and poor decision-making. Manic episodes can be triggered by sleep deprivation, so it's no wonder that the most common time for a woman to have her first manic episode is following childbirth. For women with a history of bipolar disorder, it's very important to develop a plan prior to the arrival of the baby for getting sleep once the baby arrives. Getting adequate sleep can help stabilize mood and reduce the likelihood of manic or depressive episodes. Women with bipolar disorder should be closely monitored by a perinatal psychiatrist during pregnancy and after the baby arrives. The hallmark of psychosis is the presence of hallucinations and/or delusions. A hallucination is a perceptual disturbance, usually seeing or hearing things that are not really there. A woman may hear voices that feel very real to her. Delusions are beliefs that are not based in reality. For example, she may see a stop sign and believe it's a personal message of deep significance for her. Postpartum psychosis is a psychiatric emergency. Women with postpartum psychosis are at a high risk to themselves and their baby. Without proper treatment, it is not safe to leave mom alone with baby. If a parent experiences symptoms of postpartum psychosis, they should go to an emergency room and to obtain treatment immediately. Next, let's talk about anxiety in the peripartum setting. Anxiety can manifest in different forms, including generalized anxiety, panic disorder, obsessive-compulsive disorder, or post-traumatic stress disorder. Anxiety disorders sometimes coexist with depression. Let's start with the mildest form, postpartum adjustment with anxiety. With this, a person may feel stressed, overwhelmed, or worried. It's a milder form of anxiety than full PPA and usually lasts less than a month. Meeting with a therapist can prevent anxious postpartum adjustment from becoming postpartum anxiety disorder. Almost as common as PPD is postpartum anxiety. About 20% of women who screen positive for PPD at the 2-week screen also screen positive for anxiety. Symptoms of PPA are intense stress, fear, and worry, often focused on your baby's safety and her health. For some women, PPA makes them feel afraid to be away from their babies, while other women are afraid to be left alone with their babies. I want to be clear, it's normal to worry about your baby. In fact, it's a sign that you care. But with PPA, the fears become so significant that you begin to seek constant reassurance. You change your behaviors to accommodate these fears. For example, instead of taking advantage of rare moments to sleep at night, you repeatedly get up to check on your baby. When you're apart, you're afraid for the baby's safety, even though you left your child in good hands. And when you're with the baby, you may feel insecure and are terrified to be in charge of their care. The fears can override your ability to take good care of yourself. The mind goes into overdrive and prevents you from enjoying a peaceful moment. Instead, you're busy thinking of all the bad things that could happen, not the good that is happening. The what-ifs become foremost in your mind. Quiet moments can be taken up scanning for potential threats and imagining scary scenarios. This really takes away from your ability to be present and enjoy life. Physically, anxiety feels uncomfortable. Some people experience nausea or lack of appetite. Others with anxiety have chest or abdominal pain or headaches. Some people feel revved or shaky. When I experienced PPA after my second child, I felt like a guitar string that had been plucked and was perpetually vibrating. Panic attacks are sudden, intense bursts of fear that seem to occur at random times and last for a matter of minutes. Some classic symptoms of panic attacks are feeling like you can't breathe, dizziness, heart pounding, lips or hands tingling, and trouble thinking. In the midst of an attack, people often feel like they might be dying, although you are perfectly safe. Usually, panic attacks seem to have no obvious trigger, causing people to doubt that it's really a panic attack. A person may not have been worried just before the onset, but panic attacks tend to occur more often during times of overall stress or life change. What causes these unpleasant episodes? They are essentially a misfire of your body's natural warning system. Your brain mistakenly sends a signal to your body saying danger, when in reality there is no actual danger. Nonetheless, the signal goes to your adrenal glands, which make and release adrenaline. It signals your heart to beat faster, you to breathe hard, and shunts your blood to areas that can help defend yourself in times of danger. This would be very protective if you're running away from a bear or danger, but with a panic attack, the perceived danger is just background stress. Women with a history of OCD are more likely to experience an increase in their symptoms after delivery. While full OCD is less common, many people have mild OCD traits that can worsen during the postpartum period, likely due to the stress of caring for a baby and lack of sleep. After having a baby, women develop what I call your baby radar to scan for any possible harm that could come to your baby. Sometimes your baby radar can go into overdrive. In trying to avoid harm, women can develop obsessive thinking about highly unlikely scenarios. The fear becomes bigger and bigger until this unlikely event seems like an inevitability. Fears become irrational. For instance, a woman might be afraid she will drop her baby. This is a common, appropriate, protective concern for parents. However, with PPOCD, accommodations to reduce the fear become irrational. For example, she may insist she can't hold the baby unless she's sitting on the couch. This makes her dependent upon others to bring her the baby, which impedes her ability to function in her own home and to care for her baby independently. PPOCD is different from postpartum psychosis in that a mother with PPOCD is disturbed by her thoughts of harming her baby, whereas in psychosis, thoughts of harming the baby seem necessary to act upon. PTSD is a type of anxiety disorder brought on by experiencing or witnessing a terrifying or traumatic event. Some women develop PTSD as a result of their birth experience. Births don't always go as planned or hoped for. Sometimes deliveries require urgent medical measures. Transitioning to a vacuum-assisted delivery or C-section can be rapid. The atmosphere can be tense. How scary a woman views her experience affects her likelihood of developing PTSD. Sometimes interventions that a doctor may see as routine can be viewed as terrifying or traumatic to the patient. The difference in reactions could be due to multiple factors: the way your healthcare team communicates with you, the medical situation, the outcome, and your attitude and beliefs towards medical intervention. Process your experience with your obstetric provider. The medication Prenatal, if given within 24 hours of delivery, may help prevent postpartum PTSD for women who've had a traumatic delivery. Relationship and marital distress. Having a baby with someone is like taking a job at the same place as your spouse. You're in the trenches together, sharing the common goal of raising a happy, healthy child, but there are downsides to working at the same office as your spouse. Your communication style becomes instantly more important. Both of you will be pushed past the point of exhaustion and care for your child. You will need each other's support and to give when you feel like you don't have anything left. All your focus can be easily diverted towards caring for the child, and little energy is left for caring for your relationship as a couple. Dads can get postpartum depression too. A study published in Pediatrics in 2014 demonstrated that depressive symptoms in fathers increased on average by 68% after having a baby. Research studies estimate the prevalence of paternal PPD to be somewhere between 4% and 25%. It's generally estimated to be about 10%, which is only slightly lower than for women. Despite its prevalence, paternal PPD is rarely acknowledged, even by the medical community. The struggle one parent feels impacts the other. In my practice, I often find paternal PPD often begins just as the mother recovers from her depression. The father has been pushing himself hard to hold everything together while the mom has been depressed. Once she improves, he can finally slow down and all his worry, disappointment, and exhaustion come forward. The harm of untreated paternal postpartum depression includes increased rate of emotional and behavioral problems in children, impaired ability to attach to their child, and increased conflict in relationships, as well as increased risk for mom developing PPD. Self-care is essential for dads too, and seeking help from a therapist is a great place to start. Most women will have some sleep disruptions during pregnancy, and all mothers will have trouble getting enough sleep after the baby's born. But while sleep deprivation is common and normal after having a baby, insomnia is different. Insomnia is the ability to sleep even when the baby lets you. Insomnia can mean having trouble falling asleep, that's initial insomnia, or waking in the night and being unable to fall back asleep, terminal insomnia. In addition to feeling tired the next day, lack of sleep can cause irritability, lessen your motivation, and impair your memory and your ability to concentrate. Prolonged sleep deprivation worsens anxiety and depression. For women with bipolar disorder, getting sufficient sleep is essential for mood stability. For these reasons, sleep techniques are a big part of this course. Although it's not an official diagnosis, postpartum rage is a common phenomenon. This is when moms find themselves having bouts of often sudden anger. They can yell or be highly critical of their spouse. They can also be more likely to yell at or even hurt their babies. This course will give you the tools to prevent postpartum rage. Most of the time, those with postpartum rage need more sleep, time away from the responsibility of childcare, and to get more help at home. Postpartum rage is about unmet needs. Occasionally, postpartum rage is a sign of bipolar disorder, and further help is needed. Depression can impair your ability to attach and bond with your newborn baby. Difficulty bonding is a common reason women decide to see a perinatal therapist. Lack of bonding fills the mother with guilt and self-blame, and her depression or low mood can get worse and worse. When bonding has occurred, we call that attachment. Attachment is the basis of your relationship with your child for the rest of your life. Your attachment to your baby makes the sleepless nights tolerable and the baby giggles absolutely delightful. When it's not there, motherhood doesn't feel as good. The importance of successful bonding and attachment are huge reasons why preventing and treating postpartum depression is so important. Tobacco, alcohol, and drugs, including natural substances like marijuana, are known to be unsafe in pregnancy. If you find it hard to abstain from these substances in pregnancy, please seek professional help. Please know you are not alone. Many women struggle with addiction in pregnancy and fear of the stigma too much to reach out and get help. There is no shame in making positive changes for your baby. If it were easy, you would have already done it by now. Addiction gets in the way of being the mother you want to be and the mother your child needs. Getting help for addiction is the single most important positive step you can take for your baby. To tackle these difficult issues, look until you find a counselor that you feel comfortable with. For referral and information for treatment, you can call SAMHSA's National Helpline, 1-800-662-HELP. It's a free, confidential, 24/7, 365-day-a-year treatment referral and information service for individuals and families facing mental and/or substance use disorders.